Hello, my name is Wayne Reese and I'm Senior Vice President with LED Dental, and we are the manufacturers of the VELscope VX oral examination system. We are very proud to accept the Pride Institute Award, and it's something that means a lot to our company. We're going to talk a little bit about the system, but I want to first express that the mortality rate for oral cancer has not decreased in the past 3 decades. Now, how does that happen when we do such a good job with other cancer states such as cervical, breast, prostate cancer? The reason is we have screening protocols for those cancers using technology. We've had tremendous success. In dentistry, normally we've been finding oral cancer late stage. Problem with that is 52% of the time that patient is going to die within 5 years. If we find the disease early, it's 80 to 90% curable, and that is really the goal. What the VELscope allows us to do is find the disease many times before it's even visible to the naked eye alone. That's a home run for the practice. In addition to finding precancer and oral cancer, the VELscope also finds other disease states such as bacterial involvement. It shows up orange. Fungal involvement, that shows up a yellowish orange. And precancer and cancer is a loss of fluorescence and shows up dark. Now, fluorescence itself has been used in cancer detection for a number of years. It was originally developed at the British Columbia Cancer Agency, and the LIFE system, which was the lung fluorescence system, was the first system available, and the actual VELscope spawned out of that technology. So we'll look at how it works now. The VELscope is an adjunctive technology. It is not meant to replace the biopsy. It is to be used as an adjunctive technology. Medical history, palpation, extremely important. White light exam. And then the VELscope exam should take no longer than 2 minutes. There's no dyes, there's no rinses, there's no pain. You can use your loupes with the examination. So it's a very simple examination to do. You simply turn the light on and go through and do your examination. It's interesting to note that oral cancer has changed over the years. First of all, we all understand that our primary risk factors are elderly patients, smokers, drinkers, and they're still the high-risk population. But there's been a dramatic change in what's going on recently, and that is the HPV-16 virus. Yes, the same virus that is causative of cervical cancer is now associated with the oral cancers. That means it's a sexually transmitted disease. That means we need to be very diligent in our entire patient base. We need to be screening on a regular basis. There was a recent study done by the Henry Ford Hospital, and it showed that there's been a 60% increase in HPV-related oral cancers in patients under the age of 45. So we are the people that have a chance to do something about this. We'll talk a little bit about how the VELscope works. What we would like to do is, instead of finding disease here when it's off to the cancer agencies, we want to be able to find it at its earliest stages. Normally we find it when it breaches the surface. But if we could find it before that, remember I said 80 to 90% curable, and that's really the goal. So what the VELscope does is it takes a safe blue light and shines it down into the stroma. At this wavelength, which is a safe blue light, it causes the cells to give off energy in the form of fluorescence when healthy. We filter everything else out but the fluorescence. What happens when cells begin to misbehave? A couple of things occur. Down in the stroma, the collagen cross-links actually adjust even before a cell is reproduced. That gives us 60% of the loss of fluorescence. The next thing that occurs is, as part of the Krebs cycle, FAD, which is a fluorophore, is reduced, again eliminating some of the fluorescence. Later on in the disease cycle, more blood to those cells, angiogenesis. But that's how it actually occurs. What does it look like, though, as a clinician? As you see, we're looking into an image here, and it's blown up very large, and there's a carcinoma in situ in that image. It's very hard to see. But with the aid of the VELscope, you'll see the loss of fluorescence. It shows up very, very clearly. Another image on the palate, can't see anything going on. But under the VELscope, it shows our problem. So early detection is absolutely the key. There's also a fee code for the VELscope, and it's DO431. $44.50 plus expenses, but we recommend charging $15 to $20 because the insurers are more likely to pay it that amount, but also it's easier on the patient. So one of the nice things, it's a win-win for all parties. We can find disease early, it helps market the practice, and we may be able to save a life in the practice. In addition, the Velscope allows us to do photography. We can attach a camera to the scope. If we see something we're not sure of, we can take a photograph. And what that allows us to do is to track the lesion over time and or communicate with the clinician. So I think that's mandatory in the dental practice. So that is it for the Velscope. Again, like I say, it's a true win-win. If we're going to make a difference in the mortality of oral cancer and change this disease state like we have in the other areas of cancer, we need to be screening on a regular basis. Our patients are in on a daily basis. We need to be screening as a standard protocol. And Velscope assists us to find disease early. Thank you very much.